Hello everybody, Bismillahirrahmanirrahim. So a 1-year-old boy is evaluated in a nursery for microcephaly. For microcephaly. He was born via spontaneous vaginal delivery to a 26-year-old woman who did not receive prenatal care. The mother has no known chronic medical condition. On physical examination, the boy occipitofrontal circumference is more than 3 standard deviation below the mean. The anterior fontanelle is closed and the skull is partially collapsed. Cardiopulmonary examination is normal. The abdomen is soft, non-tender, and has no palpable masses. Multiple contracture and the right glove foot are noted. The infant has marked hypertonia. Imaging showed thin cerebral cortex and multiple intracranial calcification within the cerebral cortex. Which of the following maternal risk factor is commonly associated with this infant presentation? Consumption of unpasteurized dairy products, daily alcohol consumption, and inadequate folic acid supplementation, not adherence to vaccination schedule, travel to a tropical mosquito infested region. So first of all, this is a 1-year-old boy evaluated for microcephaly because he having a head circumference for more than 3 standard deviation below the mean. So he having the microcephaly. This is the first hint. The second hint is that the anterior fontanelle is closed, mean collapsed. The skull is collapsed. Anterior fontanelle is closed. Third, she having multiple contracture. The boy having multiple contracture. Four, and he having a right club foot. Fifth, he having the infant having hypertonia. And 6, he having intracranial calcification. So based on these 6 hints, what is the diagnosis of this question? So the diagnosis of this question is congenital Zika syndrome. Zika virus, Zika syndrome. Congenital Zika syndrome. So here the correct option is choice E, travel to a tropical mosquito infested region. So this infant with severe microcephaly likely has congenital Zika syndrome. Zika virus can be transmitted via an Aedes mosquito bite. Women infected with Zika virus are frequently asymptomatic. However, during pregnancy, transplacental maternal fetal viral transmission may occur and result in fetal disease. Zika virus preferentially destroy fetal neural progenitor cell and resulting in the abnormal brain development and neuronal destruction. Therefore, in addition to the severe macrocephaly, infants typically have a thin cerebral cortex with multiple intracranial calcification. Additional clinical features include a closed anterior fontanelle, multiple contracture, and hypertonicity. Diagnosis is confirmed with Zika virus reverse transcriptase PCR performed in newborn serum, urine, or cerebrospinal fluid. Management of congenital Zika syndrome is supportive with continued evaluation of sequelae. Due to the risk of congenital Zika syndrome, precaution for pregnant women include avoiding travel to tropical mosquito infested region. Now come to the incorrect one. Choice A, consumption of unpasteurized dairy. So consumption of unpasteurized dairy products is a risk factor for Listeria monocytogenes infection and congenital toxoplasmosis. In utero, Listeria monocytogenes cause fetal demise or neonatal disseminated granulomatous disease. Congenital toxoplasmosis can cause intracranial calcification. Choice B, daily alcohol consumption. So fetal alcohol syndrome can cause microcephaly. However, there is no associated craniocytosis or skull collapses. Choice C, inadequate folic acid supplementation. So inadequate folic acid supplementation is a risk factor for fetal neural tube defect, including anencephaly. Choice D, non-adherence to vaccination. So a non-adherence to vaccination schedule is associated with increased risk of congenital rubella syndrome, which can cause microcephaly. However, patients typically have a large anterior fontanelle, cataract, and cardiac defect, where this patient doesn't have. So now come again to the choice E. Why the choice E is the correct one? Because this infant boy, 1 hour old boy having the microcephaly, the anterior fontanelle is closed. He having multiple contracture with the right left foot, and the infant having the hypertonicity. So the diagnosis of this question is congenital Zika syndrome, and congenital Zika syndrome is a Aedes mosquito-borne illness. So patient will have to avoid traveling to tropical mosquito-infested region.